you. Now we're gonna listen to Murilo. Murilo Contó, he works in Brazil since 2008. He has experience with the Pan-American Health Organization. He works with Boston Scientific, and he worked with the Ministries of Health, and he has expertise on the national level. He's gonna present his look at the cost effectiveness from national perspective. Please, Murilo, the floor is yours.
Thank you, Riyad. It's a pleasure to can share with you some experience during my time in Ministry of Health and the PAHO-WHO office here in Brazil. To start, I think it's important to say that the Ministry of Health here, to understand the process of the investment in medical equipment here, the Ministry of Health here meaningful financial research to the state for medical equipment purchase. Actually, any kind of institutions like linked with the public health system can request this research to buy medical equipment in local purchases. To receive the research, the institutions have to present an investment project with basically nomenclature of the equipment, quantity, and technical specifications of the medical equipment required. In the beginning, the scenario that we find in Ministry of Health was a lack of standard list of the financeable equipment, lack of standard nomenclatures, no limit of value or price of the equipment requested, possibility to request equipment not approved by CONITEC. CONITEC is our national commission to new adoption, new technology adoption in the public health system. In other words, it was possible to request some technology not cost effective. The analysis the projects to identify the corrective institution, and this was a very slow process for approval. And when we started the work there, we only approved it around 1,200 projects. Next, please. Yeah, and what we did, basically we created a national list of medical equipment for the public health system by the minister ordinance, and with the same ordinance, we create a system called SIGEM to organize the equipment from the national list, RENEM. And that system, SIGEM, consists basically in the 5 main models. One model to organize the structure of the health service, the healthcare facilities and their ambience. An internal model with a research tool to recover the historical of investments. This is a very important tool because nowadays this tool allowed the Ministry of Health be able to identify how many ventilators, for example, we have spread all over the country, identify exactly the quantity and the address of the healthcare facilities that 3, an interface web for technical and economic information, consultation from the external public, a tool for multiple choice configuration with limit of prices and some suggested specification with a pre-approved price. And the last one, the bench of prices and technical information got by a program that we created called PROCOT, in cooperation with the industries, in the national and international industries, to get the technical and economic information. Next, please. Here, just to illustrate that 5 tools, this one is the distribution of equipment according to the complexity level of the services and type of application. For every kind of healthcare facility, we can see here in the column of the left, one example of the and high complexity service, and we have only medical equipment appropriate for this kind of service. And the right side, we have an example for a primary care unit with only basic equipments with low complexity, for example, with manometer, stethoscope, and other basic equipment. This is to avoid that some institutions or healthcare services with low complexity ask some technology, like, for example, CTs or magnetic resonance scanner. The next one. Yeah, this is the picture about the PROCOT, the bench of price and technical information, with the bench of quotation, brochures, a list of vendors and suppliers, and all this kind of information sorted by year. Is very important to consult the price and the historic of price year by year. Next, please. Some examples of that kind of information about price and technical information got by the cooperation program and PROCOT. Next one, please. This is the example of the multiple choice tool with configuration price limit. We got an automated analysis with this tool in the technical specification for many equipment. This is an example for a vital signs monitor. And with this tool, we can promote over than 700 combinations, different combinations. In the right side, we have the features like, for example, battery life, size and type of screen, types of the vital parameters that the monitor must have. And the right side, we have the options. And with each option, we have a value to add in the final price. Next one. This is the example of the web interface for the external public consultation, consultation about the technical specification, prices, vendors, and very important to support the managers, the health managers in the states and the city and the hospital spread in all over country. The next. Yeah, our main results with this initiative, the quality of projects got a meaningful improvement. After we finished the whole implementation, the investment projects approved, it was almost 4 times higher than the previous year, with some number of the analysts. And that time we had 10 members in the team among clinical engineers, health technologists, and nurses. And the financial resources were invested with more efficiency in this case. We can multiply twice the amount of investments in medical equipment in our country. Next, please. Yeah, this is the experience in the international organization at PAHO and WHO Brazilian office. Basically, the PAHO works in cooperation with the local governments. In our case, our main cooperation with Ministry of Health and our regulatory agency, the Anvisa. And our roles basically, it was the adoption, to support the adoption of new technology into public health systems, support the National Commission for New Incorporation, new adoption of technologies, basically preparing reports with scientific evidences based in HTA practices, and of course with cost effectiveness and budget impact analysis. Also, we worked with capacity building in HTA and HEM, especially in medical device, because it's very different to make the to evaluate medical devices and medicines, including, of course, issues about clinical engineering. We promote a lot of workshops and courses in partnership between Ministry of Health and the WHO collaboration centers, like, for example, the Universidade de Santa Catarina with the Professor Renato Garcia here in Brazil, and also the University of Vermont with Mr. Toby Clark, a very good partner of the PAHO for our Americas region and Caribbean to support in this kind of activity and capacity building. Also, we developed some guidelines and other publications in HTA, some report, for example, based in evidence-based. And three, we had a lot of participation in national, international networking groups. For example, we organize a lot of meetings and webinars with partners in partnership with the REBRATS. REBRATS is the HTA Brazilian network, and REDETSA, the HTA Americas network. And we have a very meaningful achievement in São Paulo, in Brazil, 2017, when we organized the first Latin American and Caribbean Summit on Clinical Engineering in Health Technology Management, in partnership with IFMBE and the American College of Clinical Engineer as a pre-conference of the second International Clinical Engineer and HEM conference here in Brazil. Next, please. This is some examples of our activity in PAHO, the meeting, the LA summit, and the guideline about how to evaluate medical equipment in the HA principles, and also the report about the robotic surgical device, the Da Vinci Robo for surgical practice that we prepared to support the decision make of the Conitec in Brazil. Next. In conclusion, and don't ask me only 3 leadership skills learned, but I put a little more. Basically, I think we have to have the winning spirit to demonstrate the goals worth, keep the focus, hard work, and to believe in our projects. And the participative leadership, share your ideas with the team and stimulate the suggestions and improvements. Call the team to be part of the project, to exercise the capacity to listen and open mind for new ideas, and open mind to listen to some criticizing also. And the capacity to organize efforts and synergy, basically identify talents, in other words, right people to the right task, and promote the collection and registering data. It's very important. If you didn't write and you didn't register, you didn't make it. And be part of the decision-making process with data. I think we have to get used to having data as our best friend. Never go to the meeting, a decision-making meeting, without data. I think this is my message. Thank you very much for the opportunity and your attention.